What's up everybody, Dr. Horschig here from SquatUniversity. I'm joined today by Cash and we're going to do a quick video on fixing one of the causes of low back pain. Now he's been complaining of just a little bit of pain. You can turn around real quick. Right in this area. So I'm going to show you guys a simple assessment today that you can do to sort of see what one of the underlying causes may be of that back pain in a quick fix. So first things first, he's going to go on his back. And what we're going to do is a single leg bridge test. What we're looking for are what are your go-to muscles during hip extension, which is obviously the movement of getting out of the bottom of a squat. So he's going to have one leg here, one leg here. He's going to do a single leg bridge, and I'm going to have him hold it for a couple seconds and ask him, what do you feel that's working really hard in this position? And what's working really hard?
So my low back on this one.
So he's feeling his low back during this. What I'll usually ask is, what are you feeling? Your back, your butt, your hamstrings, your quad. He answered his low back, which is the wrong answer, something we don't want to see. What we're looking for is, obviously I want to see those glutes turn on and be the main go-to muscle to get out of the bottom of the squat. So I'll also have him do the same thing on his other side. So bridge up. What muscles do you feel working really hard?
This one more, my glute.
So he feels his glute more on that left side, but when he did this right single leg bridge, he felt his back working really hard. That's telling us that his right glute is not firing as it should and being the main driver out of the bottom of the squat. So a simple way that we're going to fix that is with the double leg version of the squat. So I'm going to put this around the knees. The first thing we're going to do is have his knees space apart like this. What that's going to do is turn on the outside of his hips, his glute medius if you want to get exact. Second thing, I'm going to have him brace his core. Now the cue that we're going to use is to brace your core like someone's about to punch you right in the stomach. And what you'll see is these muscles will tighten down. If you see an athlete's stomach push out, it means that they're tipping their pelvis forward and they're using the rectus or their six-pack muscles. We want to brace down, and I'm actually going to have him hold these muscles on the side. If he can feel those muscles tightening up on the side of his core, he's doing it correctly. If he braces down, he's going to flatten his back out against the ground. Then he's going to lift his butt from the ground and hold it for 5 full seconds, squeezing his glute muscles. So brace, then lift. Hold for 5 full seconds, squeezing your butt muscles as hard as you can. You can also drive through your heels and even pick your toes up. That sometimes can excite the glutes just a little bit more. And then back down. So again, brace, lift, hold, and what are you feeling when you're doing this?
All glutes and hamstrings.
So he's feeling all glutes and a little hamstrings, but he's not feeling that back. What this means is we're retraining the proper coordination of getting his glutes to fire, keeping his core braced, and not overusing certain muscles that should be used for other things, like keeping his back nice and stable. So this is something, he can relax back down. I would have him do probably 2 sets of 20 for a 5-second hold, and do that maybe once or twice before his workout, and do that every day until he can correct for the problem. Hope you guys liked today's squat, fix. We'll see you next time.